what is big picture vision for you? For example, 3 years from now on, where you want to be?
So what we've been working on is really utilizing and leveraging AI to do the heavy lifting and the parts that are redundant, so we can really hone in and focus to be able to reach more individuals, because I don't want to scale. We've had a lot of places that are around here that grow very fast and their quality of care diminishes exponentially. It's really sad. So our thing is how do we continue the quality we're doing while starting to pivot more towards online for those that are working, maybe haven't lost everything yet, but they're in that in between. And so that's really what we're working towards.
Welcome to the Convergence Play podcast.
Thank you so much for taking out time and being open to this idea of conversation. I really appreciate your time and availability for this.
Absolutely.
So I think we can get started. And I was going through your profile, and you have an very impressive profile, especially working in mental health domain. So I think it would be a great starting point if we get to know a little bit more about yourself, your experience, your past history. And I think right now you are building your own applications at Pacific Shores. So if you can talk about your vision for this company as well, I think this can be a good starting point for us.
Okay, well, my name's Mark Manderson from Orange County, California, and I run a company called Pacific Shores Recovery. And one of the unique things we get to do is we help people with mental health and addiction struggles. And so we've been doing it we just actually surpassed 25 years. So it's crazy when you start something just from heart and not know what it takes or what it entails, and then all the crap that happens. But at the end of the day, what I've found is when you lead with your heart, you tend to find ways to reach through to the client and to make the impact and the generational change that you look to make.
Awesome. Awesome. Thank you. Thank you for sharing it. It looks like a very long period to be in this space. And I'm sure you mentioned about challenges. I think that's what we are really looking forward to listen to. What kind of challenges and how you overcome that, because a lot of our listeners are actually C-level executives or founders, and so many of them are also people who are looking to start a business in digital health space. So of course we would love to know about the initial challenges that you faced when you were starting this journey, and if you can highlight a couple of those, I think that can be a great starting point.
Yeah, I wouldn't even know where to start as far as when you mentioned challenges. So I'll go all the way back. One of the biggest things that I continue to learn and relearn is because we were new to this industry and just wanted to help individuals. So my story is at 8 years old, I walked in on my aunt. I'm the one that found her when she overdosed in my bedroom. And so that leaves a mark, right?
Yeah.
And so that really got me to thinking of what can I do to help educate families. Obviously not at 8, multiple, 10, 15 years later, as I went through school and just kind of struggled through a lot of things. I saw a lot of people who had their purpose and their vision and knew even before school what they wanted to do. It was like there was an orientation packet given at birth, and I felt like I missed out as I was spending time with businessmen and women and entrepreneurs. And so when we started, we basically just started of seeing where the gap was in the marketplace. So back then, there were treatment centers. There was a very few, but there was nothing really called sober living. And so what we do is we would help house them afterwards and help them reintegrate back into the real world, because in the bubble of recovery, it's very easy to stay sober. But when you get back in the real world, those triggers, the stimulus hits and chaos starts ensuing again. And when your drug of choice, or the way that clients would sedate, is now an option again, a lot of people would revert. So that's what we got started with. But one of the biggest things that I struggled with for the longest time was first that internal narrative of, what the hell am I doing? I don't know what I'm doing. I suck at this. And then added on top of that, there are other people in the industry that came in and kept telling us, you're doing it wrong. You're not doing it right, because we were client-centered. Of my philosophy, I call it Christ-based. It's love the person, hate the sin. And so we came in and we would just unconditionally love the individual and then hold them accountable to the behaviors. So it wasn't of like a lot of places say, we break people down like the military, we break them down and then rebuild them. Our thought process is nobody's broken and nobody needs to be guilted or shamed into change. That doesn't seem to work. And so as we started from this, it was really trial and error. And when we first started, we didn't know what we were doing. It was just, don't use while you're here. And then as people were struggling, I've never been afraid to ask dumb questions. That's something that I struggled with in school, but now in the real world, I'm like, wow, that's actually a superpower. I can
Right.
ask the questions that most people think that is such a dumb question, but afterwards, 2 or 3 people would come up to me in class and say, "Thank you for asking that. I didn't make sense, but I didn't want to look stupid." I'm like, "Well, then I'm your guy. I don't want to look good. I want to be good." And so I just started asking our clients if, why did this happen? What do you think got in the way? What can we do to help? And so we just kind of not knowingly, but reverse engineered what we do now. And so eventually we saw the gap of what's now called outpatient, which back in the 90s, late 90s, early 2000s, there wasn't really outpatient. And so this helps with therapy and coaching and guidance and directing to how to get back into the real world, but actually of being able to process using different modalities. And so we did that for a while and started doing really well in that. And again, people kept coming in saying, "You're doing it wrong. You don't know what you're doing. You're gonna crash and burn." And so many times I almost listened and began to change what we were doing and our whole organization flow of what we were doing. But just that only thing I can say is that little voice kept whispering louder and louder of just keep taking direction from me. Do it this way. There's a reason why you're getting the results. And so we started doing results. We do a 6-month follow up, a 1-year follow up, a 3, a 5, and then now we just did a 20-year follow up as a case study. And just beautiful things happen when you are fully invested into the program. So, kind of a long answer, but to stay the course when other people are telling you you're doing it wrong, to be open to feedback, but when you're seeing the results, sticking with it, because ironically, now the people that were saying you're doing it wrong have actually come in to say, can you show me what you did, how you're able to train your employees because they stay longer with you than with us? We want to learn. I'm going, wow. So first they said I'm doing it wrong, kind of teased me. And now they're coming to me asking, how are we doing it? So that comes at the end. And most people share that
Right.
and miss this early part where all the struggles are, where everything in you is saying, you know what, you're doing it wrong. You're an idiot. You don't even know how to do this. Just do what everyone else is doing.
Absolutely. And I think, Mark, I love your passion for what you are doing. I mean, it's so refreshing. It's so energetic, and I think again, authenticity is one of the best quality in founders and leaders. So I see that in you, and it is so refreshing to experience that. So for the sake of our listeners, if Pacific Shores application, if they have to use it, or if somebody have to onboard on that, what is the process and what is the requirement for that? Is there any onboarding process, or it's simply
Big time.
you can download it or start using?
So a burnout in the mental health and addiction field is one of the highest in all industries. And so by recognizing that, and we completely changed our model, I don't know, maybe 10, 15 years ago, because we started seeing the burnout. And one of our main objectives is when a employee comes in, we don't just want them to be a wonderful asset for each other and our clients. We want their lives to be better. So it actually starts at the very top. How I show up every day, I'm very clear. I actually do weekly leadership meetings of the habits. We call it healthy selfish here. And actually, I wrote a book. This is for clients, but all the framework is here. It's called Healthy Selfish or First Fruits. That first hour of every day, we're looking at 5 different foundations, and it's basic foundations that push the needle forward in life. And so I lead from where I live, and then I show our employees, and then they're actually starting to engage in this. So they lead from where they live for the clients. And so that is one of the cultural things that we do here to say, if you want to be a part of this, it's not a job, because you really have to care and actually give a crap about what we're doing here. And so we have a screening process. One of the other things too is I'm always split testing our ads, looking for like the classified ads. What I noticed is, at least in our industry, a lot of people would put what the company wants. And so I started saying, well, how would their life be better working for us than anybody else in this industry or any industry? And so we just started sharing of what to expect. If you're looking for this, so disqualifiers, we're not the right place for you. If you are wanting this in life, if you're wanting a work-life balance and how to
Balance,
do that. And
mhm,
so that's just on the very front. And so that weeds out quite a few people.
right.
Then we go into kind of what our values are and our mission. We want to impact. We want generational impact. It's not just for the person here, but it's for the person here that heals, and then their kids see that, and the lineage changes. So I don't take it lightly when I say these things. A lot of people come in and they refer to clients like they'll say, "Oh, I." So this was one of the things way back in the day. We had someone on our sales and marketing say, I just closed a client. And I said, no, 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 this is a human being. This is a soul. We don't close souls. We help provide the tools and resources for them to change their entire life. So when you're reporting back, I love the enthusiasm, but I want to get rid of dehumanizing what we're doing. And it's, we just helped another soul and a family. That's what we're celebrating. And it took a while, but it completely changed. And he went on to open his own company. Now he teaches that with his sales team. So it's neat to see the ripples.
And I think one thing I would really love your input on is, especially, I think a lot of companies are struggling with this mindset of bringing excellence to workplace. So they probably end up hiring the best out in the market, but those individuals come in the company and they become part of a typical process. So I think I would really love to take your advice on how companies and organizations can uh, bring the best version of their workforce out there. What can they do to nurture that culture?
So one of the sayings we have here is hire the soul and train for the role. So that means we used to, and again, this is all from making mistakes. It took, again, we've been doing this for a quarter of a century. So in the beginning, it wasn't this way. We kept bringing people in and it was just chaotic. And so one of the biggest issues that we saw was we used to bring people in with a lot of experience in this field, but we found they were really deeply rooted in their ways. So we switched it and said, what if we started hiring for the soul, like a person that is highly empathetic, that has clear boundaries, and we can train all the other stuff, like all the playbooks and the systems and the checklists. That's the easy part. I don't know how to train a person to actually love what they do and to show up daily without fatiguing because they know how to take care of themselves. So some of the questions for our employees is, are you coachable? And a lot of times employees is kind of like, I'm just going to show up. What do you mean, am I coachable? Like, you're talking about the clients, right? Because no, are you coachable? Do you want to continue to progress in life in all 5 foundations and not just settle? And those that say, man, I just want a paycheck, we let them know we're not the right place for you. There's actually other places that pay even more than we do because they're big. Like a lot of our competitors are backed by huge, huge companies. I mean, multi-billion-dollar companies. We're a small mom and pop. We've got this little place and an outpatient. So we've stayed really small to have a high level of quality on purpose. So this is why we want to find people that this is a calling, or at least this season is their purpose where they want to give back.
Understood. Thank you. So how much you are relying on technology? If we talk about in numbers or percentage, what you are doing right now, how much you are depending on technology today, and what percentage you are foreseeing it in near future?
Well, this is what's so exciting is because with AI, especially the last 3 to 4 years. So I was the guy back in late 2024 that said, we're not going to do AI. This is human to human. We have doctors and therapists and psychologists and psychiatrists. It'll never happen. And so I had a business coach I hired in 24 and 25 who's on the front end of a lot of AI things. And he said, a lot of people have your viewpoint in the behavioral and mental health aspect. What if you found a way to actually take your company to become an AI powered company? So still belly to belly with the clients, but it's AI powered. And so last year I went all in, going to summits, meeting a lot of the people that are creating some of these things. And it totally opened my eyes. So technology before was we use a system for onboarding where there's videos and it shows how much they work through. So we automated that process for the first 2 weeks where it's just consuming. So they know the method, the message, the impact we're looking, and then we do hands-on. So we've always had systems. Well, I shouldn't say always. probably the last 15 years is when we figured out we needed systems because it all fell on me. So we started building out systems. So we've always had some type of automation in that process, but just starting late 24, early 25 is where we started bringing in more AI into follow up. And a lot of people think it's a set it and forget it. What we found is we want to build out all the back end, if you will. But once it starts engaging, we want human touch on that. So that's where our team goes in and begins to take on of really messaging or calling or following up with those clients. So we use AI first to engage, and then once we actually start meaningful engagement, that's where we come back online to take over. So that's on the marketing and follow up side. And then what I'm really excited about is getting into a vibe coding and creating custom bots.
Right.
Is it really helps train our team, because our playbook now, I don't know, it's like 200 something pages over 25 years. Nobody reads that. So what we found is it's a great quick fire away when a person, an employee is saying, I forget the system for this. All they do is go to our custom AI, and then it actually engages and has a conversation with them to walk them through. And it's all based on what we built on the back end. So it's a wonderful resource for ongoing training, but also answering those questions. And then what is really great now with AI movement like Claude and ChatGPT
Yeah.
is our therapist, our clinical department now has the knowledge of all the creators of the different modalities. So we use them as sparring partners now. So if we have a client comes in, we're going, gosh, this modality hasn't been working based on this information. So we de-identify the information, and then we go ahead and start sparring with different modalities to find out what is one that we're not seeing. We've tried X, Y, Z. And one of my favorite things is it comes up and says, well, have you tried this? And now our clinical team goes, oh my gosh, I haven't used that modality in a year or two. Let me try it and see. And as they come in, we're trying different angles. Now we're getting breakthroughs with clients. And that maybe would have taken a lot more time of trial and error and more sessions. So we're finding bigger breakthroughs and fewer sessions, which is a win-win.
Understood. So I really love this perspective from you, and I think when we talk to a lot of leaders, they are relying on AI. Of course, everybody is transitioning more and more towards the AI, regardless of their initial impression or mindset. But I think a lot of people have left AI unsupervised. So yeah, as you were saying, so they have an AI system in place, and it is probably sending automatic follow-ups and stuff, and they don't have human in loop at that point. I think one good thing you are doing is that you are keeping human in loop, which will definitely ensure the human touch will remain while using AI. So of course, this is, I think, in my opinion, it's a great setup you have in place. So I want to ask you about your overall team, and you mentioned about clinicians and you mentioned about other skill sets. So how much is your current team on especially medical experts, and how much of them are on more on the engineering or AI or technical side of things?
So we have a rule here is called AI first. So we're looking at it for rough drafts. So here's an analogy. Before, we were doing all the heavy lifting, like all the paperwork, all the stuff that nobody wants to do. And so the way I think about it is like when I take my car to the mechanic, they've got a machine that they put the car on, and that machine lifts the car up, runs diagnostics, but then they do the work.
Yeah.
And so I look at the same thing here. So if someone's just putting in AI and just doing that, it's like, no. The AI that goes in, that's like doing the heavy lifting to bring the car up, to diagnose what's going on and to help with some of that. And then we go in with the human touch, also the human expertise that sometimes AI misses. And one of our biggest issues was getting rid of the hallucinations. Like a lot of people that we see think it's 100%. So if you're not doing system prompting correctly, it can actually really screw it up, where someone on your team thinks they're doing what you want them to do, but AI actually took something outside of the closed loop and used that as priority versus, no, this is priority, run everything against this. So there are a few different aspects. So we say the 10-80-10 rule. So the first 10%, you got to give clear context. You got to give it the background of what you're wanting, the output that you're wanting. So there's a lot of work that goes in of saying, here's what I'm wanting to utilize you for the heavy lifting. Then you click that button, and then that's doing the 80% of helping. It's like an additional thinking cap, if you will, that brings that on. And then that final 10% is taking what it gave you, looking to see it. First of all, does it qualify for what we're doing? Is it helpful? Making a few tweaks, and then that is giving them that finished product. So like with documentation, we're able to take something that almost every clinician hates: documentation. Again,
Yeah.
25 years, I've yet to meet one doctor, therapist, medical professional that says, I love
Yeah.
writing the documentation after working with the patient. They want more time with the patient to troubleshoot in these different aspects. So what we found is we have an internal process of how we document everything. So now we've got the brains for there, so they can go ahead and give the information. It brings the meat and potatoes, and they're able to tweak different things. Look at, here's the plan that I'm going to be doing. So it helps with that heavy lifting part, if that makes sense.
Absolutely. And if we talk, because when there is AI involved in documentation and these sort of things, there always comes a concern about data security as well. And I think in healthcare, in any kind of digital healthcare business, data security is top-notch priority, because that's something, if security is not implemented right, it can kill companies overnight. So
Big
how are
time.
you? Yeah, how are you addressing this big need in your
Well,
current setting?
and that's where I started looking early 2025. Couldn't find anybody that was doing it in the healthcare field. Met with 3 different coders, AI, and every single person said the same thing. It was actually cost inhibitive to be able to do exactly what I wanted. Like, I had the vision. I said, here's exactly what I want. I still think we may be a few years from that. So what we're doing now is I had to add an additional step of de-identifying all information just for that. So we de-identify, then we take the meat of what's going on, and then when that comes back, that's how we're able to go ahead, take the information, run it to the clinical team, kind of pitch and catch to see what we're going to do, and then we run with the plan. So that is a big part that I think most people miss, is making sure that you are staying 100% HIPAA compliant.
Absolutely, absolutely. So for specific shores of application, how much additional systems it is integrated with? Because of course, this is an ecosystem, and you have to be part of that in order to expand your impact. Are there other applications you are integrated with, or you are hoping to integrate in near future?
Yes. So one of the things that we've been working on is, so I created an app back in 2018 that our clients go through. We actually have our team run through it too, but it's a static app. And so one of the things I'm excited about is actually taking the brain of that app and actually strapping it to AI to really help with that. So that's something for the clients to actually help with this journey, why they are with us, of really, really doing systematic work. It's consistent, habitual actions is what overrides the old system and creates new beliefs. And so that's why I've probably mentioned it a few times, but I am so big on consistent habits, because the habits become the identity. What habits have I done that have led me to where I am? What habits am I doing now that is getting me to where I'm wanting to go? So to answer your question, that's one area. So I guess I'll start from the beginning. So we strapped it onto marketing and sales. That's helped with the volume to make sure that we're able to help clients that we're able to help. And then one of the things I love is, a lot of the times we can't help somebody because we're such a small facility. And so if it is that way, or they don't have the financial resources, I created a 4-part scholarship process. And so it runs them through automatically. They need to show up and they need to do the work. But that's one of my biggest things too, is making sure that if a person can't either afford it, or if they can't come to us, if we're on a wait list, how do we at least make sure that they have that? So that's another automatic process that we created that's able to help an individual. So there's marketing and sales. We have AI strapped to admissions now, and it really helps with just a lot of the redundancies of gathering information of history and different aspects of being able to put it all in a certain area and to run and actually update our electronic medical records. So that's another area that we use internally. And then we use the open AI for a lot of the sparring for our clinical team, for trainings, for continual improvement. So that's another thing that we're doing weekly. And then one of the areas I'm most excited about, so to, I guess, specifically answer your question, is we're currently working on AI to help start to foresee potential relapse patterns. So if we can predict when a client is starting to show some of the old behavior, because right now there is lag time. I mean, you meet face to face, you get the reportings from the client, and sometimes you can track it. Other times you're like, gosh, we just met last week. What happened? And so that's one of the things that I'm really excited about is if we continue to look at this, which we are, then we can have these kind of yellow flag and red flag moments where it starts to identify old behavior. We're able to intervene with the client before it even gets there. That's the generational change and impact that we're
Yeah,
talking
yeah,
about.
absolutely. So, how much you are relying on video consultation at the moment? Is most of the time it's in person, or you're also using video as well for this purpose?
So because it's very unique what we do, so detox, residential, day treatment, and outpatient all happen on site here. So we
Okay.
do have a lot of in person. But there's something that I noticed probably 10 years ago is when I would get with them, I created the system. And when I was with them to get great results, when we would have one of our staff people, it was kind of hit and miss. And so using the McDonald's model, which Ray Kroc did a great job, we started looking and saying, how do we set up a system that is the same for every single person? And then we have the team individual flavor. So we have an onboarding process that is in person for those in person, but they actually go through a video series. And as they go through the video series, then they're able to interact, but it makes sure that they get the right framing, the right information. They're going through all the same assessments to make sure. And so the onboarding process, it's kind of like if you went to college, it's like when you first show up and they're kind of, here's what to expect. Here's what we're going to learn this year. So it's like an orientation for our clients. So that one we have a mix. And then we did start a virtual program in 2019. Actually, I was beta testing it, got wonderful results. And then that little thing called COVID happened in 2020. And so we already had proof of concept and beta tested. Luckily, I mean, just dumb luck, we were ahead of the curve there. And so a lot of that is still, we use Zoom, but we have a whole process. And that is where the app really helps as well, of walking them through. So it's kind of a mixture, a hybrid of both.
Understood. And I asked this question, Mark, because we spoke to some founders and they are also working in mental health space. And what they are doing is, of course, it's not yet perfect. There's a lot of room for improvement. They are using AI for sentiment analysis of videos. So, for example, if they are having virtual sessions and then they have AI in place that typically, based on different videos of a specific patient, they are AI is using some sort of sentiment analysis and giving a little bit of additional insight to doctors and physicians and clinicians. So, of course, this is not yet perfect, but it adds another layer of information and context which can become useful in some scenarios.
Yeah, that sounds like what we're doing. We just call it our sparring partner. So that's where you go back and forth trying to
Yeah.
basically kind of put holes in the file in the chart to see what is it we're not seeing, and when we're going back and forth, that's helping with that aspect.
Correct. So, in your day-to-day work, Mark, and of course, in the field you are in, is there is no shortage of challenges in your day-to-day work. What challenges or frustrations come up often that you feel are critical to your business?
Well, a few come to mind. The first thing, I'm going to go right to the solution, is I call it I call it positive intention. So many times I think as founders and C-level executives, we tend to get frustrated and forget that that person probably did what they thought was best for the company. So when I come in with positive intention, when I see all action and behavior with positive intention, it allows me to come much warmer to the individual to find out, did our process break down? So is it a person or is it a process? If it's a person, we have a whole way to help the person get on board. We do a lot of trainings and coaching plans, and if they're not able to, then we help transition them off to find another place that may better suit them. But that first part has helped me bite my tongue and help me stay really in a place of understanding and empathy while still holding that boundary. So it's that positive intention. One of the other things that I think is far and foremost the most important thing is, again, going back to the first fruits, those habits. If I don't take care of me that first hour, I show up more irritable, I make more mistakes. Um, It really is a game changer, and so I would encourage anyone watching this or listening to make sure that your daily ritual, your morning habit of first fruits, you have dialed in, because if you are not doing that and you're expecting your team to show up as their best versions, there's a
Yeah,
discrepancy there. And so
yeah.
that's why actually years ago I created a document on Google Docs that I give to our team so they all go through and know exactly what to do. And um, if you would like, I'd be more than happy to give that to any listener that says, I would love to see what you do with your team to run that through.
Perfect. Perfect. Thank you. So, do you also work with external vendors, or do you have everyone right team in place, and you have every required skill set in your team, or you are also working with some external vendors for some of that stuff?
Yeah, we still work with external. We do most of it in house, but there are times where we need a specialist, and then we have a few that repeat monthly coming in and actually helping with some of the modalities of some of the groups to give the clients something a little bit special, get to try different things. I had the privilege of meeting a gentleman named Wim Hof back in 2016. I don't know, it was a while ago, but went through his training for breath work, and it totally changed my life. And so after doing that, we actually found someone that not just knows his scope of work, but also other modalities of breath work and breathing and different things. So we have them come in. That happens to be a client favorite. And then we have a couple other vendors that come in for actual groups. And then we do use a lot of outside for different aspects that is not our wheelhouse, like billing and all these compliance and different things that I don't spend much time on, but I want to make sure our team does. So we have them coming in either monthly or every quarter to come in and to just make sure everything is happening as it should be.
Understood. Great. So we are almost in the final phases of our discussion, and I want to ask you a very important question. What is big picture vision for you? For example, 3 years from now on, where you want to be?
So what we've been working on is really utilizing and leveraging AI to do the heavy lifting and the parts that are redundant. So we can really hone in and focus to be able to reach more individuals, because I don't want to scale. We've had a lot of places that are around here that grow very fast and their quality of care diminishes. I mean, exponentially. It's really sad. So our thing is how do we continue the quality we're doing while starting to pivot more towards online for those that are working, maybe haven't lost everything yet, but they're in that in between. And so that's really what we're working towards.
Sure. Thank you so much. So, uh, if somebody is thinking about starting a business in mental health space, from your vast experience, if you have to give them one advice, what that advice would be?
Going back to the habits, I mean, it all starts with there. If a person has poor habits and isn't taking care of themselves, that's where we see burnout so quickly. That's where we see they jump from shiny thing to shiny thing. They look at different distractions. If someone says you're doing it wrong, like someone told me, they don't stay the course. And so, if they're starting something, I would say really dive in and go 100%, but make sure you are taking care of yourself.
Thank you. Thank you so much, Mark. It was a great conversation, full of insight, full of knowledge, and I thoroughly enjoyed it. I really appreciate you taking out time and sharing your wisdom. Any questions you have for me, please feel free to ask.
You got it. Well, I know the only thing I can think of is, so if somebody is looking for that free Google Doc for the habits of how I've been able to build these two businesses, they can follow me on Instagram. It's at Mark C Manderson. Very simple, and then just DM me habits, and I'll send it to you.
Oh, all right, perfect. We look forward to getting your story out in the public. We will be publishing it on YouTube and podcast in few days, and I will be in touch and I will be sharing the links with you.
You got it. Thank you so much.
Thank
Appreciate
you
you.
so much. Have a great day.
You too. Bye.